where we are going to use 16 aligners, okay, where we are going to do some IPR to reduce the black triangles, and the patient will use more class 2 elastics. And this is the situation that I planned, and I know that if you do a good job, you are going to get more or less exactly the same situation in the mouth. You look at the beautiful result where we have closed the open bite. This is the situation that was planned in my treatment plan with the clean check, and exactly what we obtain in the mouth, where the crossbite is solved, the vertical problem is solved, and the class 2 is solved to a class 1. Also a beautiful development of the arch, where we have controlled the lower incisor with doing IPR, and this is the evolution and the nice final result. Good adaptation. Remember, this is the arch at the beginning, and here I always say that the most important thing is to work with the upper arch, develop a parabolic shape of the upper arch in order to get this final result where the mandible is going to find a space to anterior-rotate to solve the class 2. Okay, so the upper arch, we always say that is the king. How we have changed from the left view to the right is a more parabolic, where the torque has been increased. That's why we have those beautiful expansion, and the lower incisor have been controlled doing IPR. 0.2 millimeters, I like to do 0.2 millimeters and symmetric IPR from distal 3 to distal 3. Okay? Where the rotation of the lower incisor has been controlled, because as you can see here, what I'm doing, I procline and rotate at the same time. But to get this beautiful and this nice result, is mandatory that you have to derotate in the direction of the proclination. I'm doing first proclination and mesial out rotation, and then distal in rotation. That's why it works. We are proclining, mesial out rotation, and then distal in. Some overjet, because we need this overjet to let the elastic work, and this is the final result in the mouth of our patient. So remember that the upper arch is the king. We have to follow the steps in orthodontic. First, work with the upper arch. First, work with the transversal plane. This is the first thing that we have to do. Work with the torque, coordinate the arch. Then work with the vertical position, solve the open bite, and at the end, start using the class 2 elastics in the case that you still have a class 2 to solve.